Hi, everyone. Thanks so much for joining us today. Today, we are talking to one of our new community partners, Dr. Kaylnn Good. She is a pediatric optometrist and a vision therapist. And I'm excited about this partnership because one of the big questions we get asked by a lot of our parents is about vision therapy, when it's appropriate, when to engage in it, or who it might benefit. So Dr. Good is going to start by just telling us a little bit about characteristics of children that would benefit from vision therapy and when would be a good time to go for that type of assessment.
Yeah, absolutely. So, in vision therapy or neurooptometric rehabilitation, we're really training the learn aspects of vision through neuroplasticity. So, what that means is our eye muscles are actually very capable, they're very strong, but we're retraining the brain to better interpret when and how to use the eyes more efficiently. So that's kind of the bread and butter of vision therapy. For our kids or even our adults, we do train a wide variety of patients in our office. A lot of the aspects that we see, or a lot of the symptoms that you guys are going to come across, are intermittent double vision, intermittent blurry vision. Those are very, very common. Skipping or loss of place while reading, skipping lines, letters, all of those things, or skipping around in a passage. Our patients will have eye strain and headaches while reading. They just, in general, avoid near tasks for obvious reasons. They have poor judgment of depth. Sometimes they will have an eye turn, so you'll see them while you're doing your literacy training, an eye will swing out or in. That's a vision issue. They have a tendency to cover an eye, so you'll see them doing this or leaning. Sometimes they'll wink an eye or they'll put something over their eye because it's just more comfortable for them to use one eye versus both eyes together. Some of our patients will have dizziness and motion sickness. Poor reading comprehension is a big one. I'll kind of go over why. Difficulties copying from the blackboard, that's also a really big one because they look far away at the backboard and then they have to shift their focus up close and they get lost. They create blurry vision. So that's a big one. Letter or word reversals, and then difficulties judging sizes or shapes appropriately. So if you guys come across any of those symptoms or characteristics in your patients, then it could be a visual processing issue. And that's when I would send them for a neurooptometric or a vision therapy evaluation.
Okay. So tell us a little bit about what vision therapy entails. I know you have some cool activities and things to show us.
Yes, absolutely. So we'll kind of go over before I kind of show you activities. We'll go over what we train because I think a lot of people don't have any idea what we train in the vision therapy room. So we do have our core visual skills, which is eye teaming, eye tracking, and eye focusing. So eye teaming, what happens is our eyes have two separate images. So we have one image coming from the right eye, another image coming from the left eye. And our brain has to put these two images together and create clear and single vision for an extended period of time. And so, with that, we're training our vergent system, so moving our eyes inward together and outward together, and our fusional system, keeping those images clear and single the whole time. So, that's our first kind of core skill that we train. Our second core skill is focusing. So, it's not attentional focus, it's actually in the eyes. But that's the visual skill where you're looking far away and then you have to quickly shift your focus up close. And then also for our kids to maintain that focus up close, maintaining that clear vision while they're reading. And then our third visual skill is ocular motor. That encompasses a few skills, but the most important ones are fixation. So having a target and then being able to move their eyes to that target and then maintain that for an extended period of time. And then smooth pursuit. So those are those smooth, slow eye movements as you're following around a target. And then our saccades, which I'm sure you guys have heard of, but those are those quick eye movements that are required for reading. So going from target to target, If we're reading a passage, they have to use small saccades, go word, 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 sweep down into the next line without losing their place. So those are kind of the main visual skills that we train in vision therapy. We also do visual perceptual testing and training as well. And so those are more of the skills like visual memory, visual discrimination, visual reversals. We also train visual motor integration in our office and other things. So those are kind of the what vision therapy, what we train. We also use a variety of activities. So most of our sessions encompass maybe like 4 to 7 activities,
Mhm.
depending upon the patient and what we can get in. But we have free space activities, so I'll show you some of those. And then we also have computer-based activities. So for free space, we're using a lot of like red, green glasses and our fixational and saccadic charts. We also use a lot of flippers. So you'll see this all the time in our office. For flippers, we can train the focusing system as well as the teaming system. So we have different ones. We use a lot of prisms in our office for training. So something that looks like this. Prisms can be used for a variety of tasks, but this one in particular is more for fusional or vergence training. We also have fusional charts that we use in vision therapy. I'm sure you guys have something like this, but saccadic sticks. We use a Brock string a lot. This is one of our favorites in vision therapy if you haven't seen it, but it comes with beads and a string. We use it like this. We can actually train a lot with our Brock strings. And then we do have 3D targets too. So we've got 3D glasses and then 3D targets that look something like this, if you can see it.
Mhm.
For our computer-based techniques, we've got a big touch screen in the office. A lot of offices have that. And we train our saccades or our ocular motor techniques as well as visual motor integration. We have an eye tracker in the office too. So that actually looks at where are my eyes or where are my patient's eyes pointed as I'm asking them to do a visual task. So we get a little feedback. The patients get a little feedback, which is nice. And then we have a projector room too, so we can do depth perception training in that room. And we have a virtual reality system. We don't use it for every patient because the visual skills really have to be in place for that. But we do use it in special cases, especially in our cases with patients who have an eye turn or a lazy eye. So that's kind of what we do in therapy on a daily basis, but we like to use a combination of all of those things.
Interesting. That's
Yeah.
awesome. Sounds like you have a lot of fun activities.
We do, and we get creative, which I'm sure you guys have to as well.
Yeah. So one of the kind of misconceptions that are out there is that vision therapy can treat dyslexia, or what we offer, structured literacy dyslexia therapy, is going to also help with some of the visual processing, which in some cases, yes, no. But can you help clarify when it's appropriate for vision therapy, when it would cross over maybe into structured literacy dyslexia therapy, but not to the extent where students would still definitely need to engage with a structured literacy dyslexia therapist. I know
Yeah,
we've talked about how there's a lot of misconceptions and just crossover. Parents don't understand, and oftentimes professionals don't understand that. So
right.
if you could.
Yeah, I think there's a common misconception in that we're thought of as training dyslexia, but I want to make that very clear. We are training the visual skills, so we're training the input system of our learning, right? We want our patients to have clear single vision, inputting that information into our brain to have a better output system, meaning we're able to decode, we're able to interpret our information a little bit more quickly and more efficiently. So one thing we do offer in our office, and most vision therapy offices will do this, is we'll do a quick dyslexia screener. So that is one thing that I don't train. I train the visual skills. And if I think that there's more of an educational component to it that needs the literacy training, then we will refer out for that at the same time. So we don't take in our kids that we suspect dyslexia and train them without going forward with additional things. So I think that's important to know.
Yeah.
And it's not our goal. We want our patients to be visually efficient and use their eyes appropriately, which improves learning. We know that. But it's not our goal to really kind of fix dyslexia or get them on the literacy path that they need.
Correct. That's great. So we often also get asked by parents if we need to do both. Maybe they've had a vision therapy assessment and we've had a dyslexia assessment and we're seeing characteristics of both. Should we do one before the other or both at the same time? Parents are often asking for direction in that respect. So what would you counsel parents as far as that?
Yes, that's probably the $1 million question with all of our
Right.
therapy.
And we all
Um,
come at it from our different bents.
yes,
So,
yes,
how
yes,
do we help the parents have the best experience
right.
possible?
So I think in all of our ideal worlds, we would have them doing both therapies at the same time, right? It's easier for our patients to go through that process. And then also it's better for coordination of care and communication between different professionals. But we know that a lot of our patients aren't able to do that. So in those cases, then I think it's really case by case basis. So if we've got a kid that has significant visual delays and deficits, then if we send them for literacy training first, we might not get the gains that we need because they're not able to see single and clear efficiently over time, right? They're not inputting that information like they should be. So I think in those cases, it might be more worthwhile to do vision therapy first and then do literacy training. In our cases, and we do see plenty of these too, they come in for an evaluation and they have some deficits of their visual skills, but they're fairly mild. Or it's mostly visual perceptual, but their core skills are intact. In those cases, it might be more beneficial for them to go for literacy training because that's what they're struggling with, and then refining vision skills afterward.
Mhm.
So I think that's a tricky question, and I do think it's case by case. But obviously, if we could be having them at the same time, I think that's the best case scenario.
Yeah, absolutely. And I
Yeah.
guess, like we always say in both fields, every child is unique and they
Yes.
have their unique profile and needs. So we try to do what's best for their individual situation and case.
Exactly. And that's one thing that is important too. A lot of patients will come in for an evaluation, but they may not have all of these issues, right? It might just be the fusional system, or it may just be visual memory. All of those things, that's what we're teasing out in the evaluation. What is needed in the therapy program, if therapy is needed. So yeah, it's important to keep that in mind that all of our patients are really unique and we have to cater our therapies to them.
Yeah. So we often get asked as well, since you brought that up, kind of what would be a typical length of time? And of course, it's dependent on the evaluation and the specifics of the child. But, we usually tell parents it is a marathon, not a sprint. So do expect to be, usually a minimum of 12 months, sometimes, more or less, depending on also the program they pick. For vision therapy, is there a typical age range or a typical time range for remediation?
Oh, I wish I could answer that
I know.
with easier. Yeah, so I would say in general, our programs typically last anywhere from 16 sessions with mild deficits to about 48 sessions for a little bit more severe deficits. We've had plenty of patients that have graduated maybe with less sessions and plenty of patients that have needed even more than 48 sessions. So definitely agree with you there. It's a marathon, not a sprint. We do run therapy in different ways here as well. So we do twice a week sessions as well as once a week sessions for patients. So it really depends on kind of what works with their schedule, what other therapies they're getting, what's kind of the best case for them. And so it really depends. It could be, just a couple months of vision therapy, but it could be, closer to 6 months of vision therapy. But I'd say that's kind of an average range.
Yeah. Well, awesome. Well, thank you so much for joining us and for the
Yeah.
information. If
I
you
hope it was helpful.
Absolutely, absolutely. I think so. Working a long ways towards just building partnerships and
Yeah,
making sure we can help our families and our kids get the best care possible. If you would like to meet with Dr. Good, she's located in Parker, Colorado. The information will be available on our website and also linked below. Thanks so much.
great. Thank you.